In this video, we are going to talk about 5 best healthcare jobs in USA. So, before starting the video, please like this video. Do subscribe and turn on the notification to our channel for future updates. 5. Nurse Practitioner. Registered nurses who have completed further schooling can become nurse practitioners. These professionals are able to gather patient histories, perform physical exams, order labs, interpret the results of the labs, prescribe medications, authorize treatments, and educate patients and their families on continuing care since they have completed additional training. Nurse practitioners, who are also known as advanced practice registered nurses, focus on a particular patient demographic and receive specialized training to work in fields such as pediatrics or women's health. They could also be employed in academic or research capacities. It seems like their work is comparable to that of a physician, doesn't it? So, what's the difference between these two? The primary point of differentiation is the minimum number of years spent in school. Physicians typically receive higher wages, have broader knowledge bases, and more extensive training than other medical professionals because of the added complexity of their jobs. On the other hand, nurse practitioners are increasingly delivering primary care to patients, which is a practice that is not without its detractors. A significant number of nurse practitioners began their careers as registered nurses, where the care they provided to patients often included elements of holistic and preventative medicine. A nurse practitioner adds this experience to the diagnosis, treatment, and management of medical problems. 4. Physician assistant. In the field of medicine, physician assistants, who are also sometimes referred to as physician associates, are extremely common. They put their medical knowledge to use by conducting examinations, making diagnoses, and providing treatment for patients while working closely with other medical professionals as part of a collaborative care team. There are several access holes across the country that are helped filled up by physician assistants. In addition to taking medical histories, assisting in surgical procedures, conducting physical examinations, prescribing medication, and engaging in clinical research, physician assistants may also be responsible for a variety of other tasks, depending on factors such as the setting, the specialty, and the laws of the state. 3. Medical and Health Services Manager. Medical and health services managers are the people who do the planning, directing, and coordinating behind the scenes at medical institutions such as hospitals, nursing homes, group practices, and other types of healthcare establishments to ensure that everything runs well. In a nutshell, they are extremely well-organized experts in their field. People who are adept at analysis and have a strong attention to detail typically work in managerial roles in the medical and health services industries. Because a significant portion of their time is spent collaborating with medical professionals, representatives from health insurance companies, and other administrators, it is important for them to have strong interpersonal and communication skills. One of the duties of the work is to find solutions to problems. These experts are required to maintain a high level of technical proficiency in order to stay up with the latest software and electronic health data. Because of the enormous number of baby boomers, there is currently a strong demand for more medical and health services managers. This demand is being driven by the fact that baby boomers are getting older and will require more medical care in hospitals, group practices, and nursing homes. A further factor is the rise in the number of group practices, which has resulted in an increased demand for managers and administrators to oversee these establishments. Between the years 2020 and 2030, the Bureau of Labor Statistics anticipates a growth in employment of 32.5% for managerial positions in the medical and health services industries. During that time span, it is anticipated that 139,600 new employment will become available. 2. Physician. When a patient experiences flu-like symptoms, discovers an abnormal mole or lump, has a headache that won't go away, or has any other number of health questions, the first person they see is a physician. These medical professionals are also referred to as primary care doctors. During annual checkups, patients are seen by their doctors even when they are in good health. During these visits, the doctors perform a physical examination and may order diagnostic tests to assist in the early detection of potential health issues or even the prevention of such issues before they arise. It is standard practice for physicians to obtain a patient's medical history and then to perform diagnostic tests in order to look for any abnormalities. Exams and test findings will help guide the doctor in deciding whether to recommend medication or a specific treatment plan. In addition to this, they provide patients with answers to inquiries regarding their health and recommendations for leading a healthy lifestyle. 1. Respiratory Therapist. Patients who have issues with their hearts and lungs are the focus of the therapy provided by respiratory therapists. They frequently provide treatment for patients who suffer from conditions such as asthma, chronic bronchitis, emphysema, cystic fibrosis, or sleep apnea. In addition, they are able to respond appropriately to certain emergency situations, such as those involving patients who are having a heart attack or a stroke. Individuals interested in pursuing a career as a respiratory therapist should be organized and detail-oriented. Strong problem-solving and interpersonal skills, as well as the capacity to operate under pressure, are essential. Students in high school can prepare for the role by studying science, math, and health classes. Respiratory therapists can get a 2-year associate's degree or a 4-year bachelor's degree in respiratory therapy. However, certain employers prefer bachelor's degrees. Some programs may have entrance criteria that involve verifiable volunteer or job experience in a setting that provides respiratory treatment, thus working or volunteering in a hospital or vent center while still in high school may be advantageous. So, that's it for today's video. What are your thoughts on our video? Please let us know in the comments section below. If you enjoyed this video and want to hear from me again, be sure to hit that subscribe button and turn on the notification to our channel before you go. Thank you so much for watching.